Ladies and gentlemen, coronary heart disease remains to be the most important and the most dangerous health problem in our modern times. And so talking about prophylaxis against this dangerous disease is always important. And today I'm not going to repeat the well-known factors about predisposition to this health problem. I'm going to talk about smoking and intake of fats and these things because these factors are now well known to most of the people. But I am going to discuss some of the most recent advances in this field in the trials carried out all over the world in trying to prevent the incidence or diminish the incidence of this dangerous disease. The first fact I'm going to discuss is based on a certain observation that has occurred in the last World War and in Norway in particular. People living in this area of the world by the time of the Second World War have got shortage of meat, of animal fat, dairy products, but they have got long shores on the sea. They can catch lots of fish, and so their food became mainly consisting of fish and fish products. It has been noticed that those people by that time, and in spite of the stress of the Second World War, have got marked diminution in the incidence of coronary heart disease. This scientific observation led to more research work, and other areas of the world have been involved in this research work, in Eskimos, in Greenland, and it has been found that in these countries, consumption of fish once per week or in amount of about 40 grams per day, daily for about 40 grams, or once per week, led to marked diminution in the incidence of coronary heart disease. Again, the same notice have been carried out in Japanese fishermen. This population also consumes large amounts of fish, and again, the same observation, there is marked diminution in the incidence of coronary heart disease. Research workers all over the world trying to make benefit of this notice, they could discover that fish contains a certain family of unsaturated fatty acids, monounsaturated fatty acids, and polyunsaturated fatty acids belonging to a family known as omega-3. This material, these unsaturated fatty acids in food, are capable of diminishing the level of LDL in the circulation, and so diminishing the incidence of atherosclerosis and coronary heart disease. Various observation studies and controlled clinical studies have been carried out in this field. It has been found that if we are going to consume fish once per week or 40 grams per day every day, this leads to marked diminution in the incidence of coronary heart disease. It has been claimed in some studies that there is diminution of 50% in the incidence of coronary heart disease among those populations. Another notice has been given is that if we combine fish intake with another food which is rich in saturated fats, rich in animal fats, rich in dairy products, the benefit of omega-3 or the benefit of fish food will not be so evident. Another notice has been given that when given in high risk, when fish food is followed in high risk population, the benefit is higher than the persons of low risk population. And so it is a recommendation for the normal population, for people with no heart disease, to consume fish at least for 1 day per week. And also for secondary prevention, for cardiac patients who already have got coronary heart disease, to stick to it and to avoid taking fats that are polyunsaturated. In another research work, it has been found that daily consumption for this for fish for an amount of 30 grams leads to another 30% diminution in the incidence of coronary heart disease. And so the importance of omega-3 family of polyunsaturated fats are gaining more and more grounds in the prevention of coronary heart disease. Perhaps I am telling that in this particular time during Ramadan month because I noticed that it is a habit of Egyptians to avoid fish all over the holy month. And I think this is not of any benefit, and I think we can take fish as well as other food, but it should not be combined with other foods that are rich in saturated fats. And as you know, saturated fats, we mean the fat present in meat and the fat present in dairy products. Another important notice that has been carried out in this respect is the effect of omega-3 fats, omega-3 family of fatty acids on the electrical activity of the heart. This electrical activity of the heart is very important for us because, as you know, that one of the most dreadful complications of coronary heart disease is sudden death. And it is claimed that in 50% of persons who die of coronary heart disease, they die in cardiac arrest. And so it is very important to avoid this dangerous complication as far as possible. And in the research work in the United States, it has been shown that every day, every week, 1,000 American citizens leave homes in the morning and they never come back because of cardiac arrest. 1,000 all over the United States per week. And so we have to avoid this dreadful complication as far as possible. Now I am showing that omega-3 fats have got an effect on the electrical activity of the heart. And this has been proved by animal experiments, also by statistical studies on human beings. And so in this holy month, we have to advise the cardiac patient, the patient with coronary heart disease, who has got no actual complications and his condition is stable. He can go fasting, but as a general advice, we have to avoid the usual foods of Ramadan months, the usual foods full of fats, full of saturated fats such as the dairy fats, the butter, samna. All of this should be avoided. Also fatty meat like that of the sheep meat. All of this should be avoided. And if he is going to take fish, this will be well and good. It has got an effect on cardiac arrest, as I mentioned. It has got effect on the advance of atherosclerosis. But it should not be combined with saturated fats, because combination of fish with other saturated fats makes the protective effect not working. This protective effect on coronary heart disease is not working if you are going to combine them with saturated fats. And so if we can use fish 2 or 3 times, especially in this holy month, this will be a good prophylaxis against coronary heart disease and against cardiac arrest. Thank you.